Today we're going to be talking about the replacement option for HCSO HRA in 2014. This is an educational event that will highlight the city's HCSO FAQs that were updated on October 21st in regards to San Francisco's healthcare security ordinance. We're going to discuss important healthcare reform changes to HCSO and HRAs in 2014. We will review how Beneflex will help your employers to remain compliant for the rest of 2013 and going forward with the HRA spend down. And most importantly, a brief presentation on a go-forward option for HCSO in 2014 by Beneflex's new partner, Brad Bilkey of the Boone Group, on how to meet the obligation and save money with the rundown HCSO HRA that you have to have in place for the next 24 months. Due to healthcare reform, Beneflex has had to update our services. We still offer the same services. It's just healthcare reform has changed what we can offer under certain tax codes and to whom. You'll notice we amended our HRA and limited HRA that work well with the health saving account that Beneflex offers. We now list San Francisco HCSO HRA as just a spend down option. And we've added exchange notices. And this slide is going to need to be updated again to add the $500 FSA carryover option that was just announced. And we are allowing our clients to do those updates on their plan documents at no charge. That's right, that was a shameless plug. So contact us if you need to do those. The impact of healthcare reform has been across the board. Starting with the premium-only plan, employers have lost the ability to pay individual health insurance premiums pre-tax. And it's the same with you were paying these individual health premiums pre-tax with the FSA. The government took that away. And on the next slide, you'll see that they also took away that advantage from the HRA. So employers need to be aware that any reimbursement or payment of individual health coverage, whether it be inside or outside of an exchange, cannot be made with tax advantage funds. The reason for the change is to discourage employers from eliminating group coverage and to make it impossible for employers to send their employees to the public exchange and perhaps reimburse them with tax-free dollars for their costs for exchange coverage. The IRS also lowered the FSA elections that you can do down to $2,500. That cap was put into effect on January of 2013. Notice 2013-54, which stirred up the pot quite a bit, states that FSAs must have a health insurance plan that the employer offers. What this means is full-time or part-time employees must be eligible for their company's health insurance in order to be eligible for their company's FSA. Now, the employees don't have to enroll, they just need to be eligible for their company's health insurance, and that way they can participate in the FSA program. And trick or treat, the government gave us a treat this year. The $500 FSA carryover option with new grace period is now available. Now our recommendation, and we did a presentation on this already before, but the down and dirty is our recommendation is if you have a grace period in 2013, we recommend you keep it. You can change to the carryover if you want, but your employees made their elections with that grace period in mind. But what I would suggest is add the carryover and drop the grace period in 2014. If you need more information, we have a webinar and FAQs posted on our website under Employer Resources. For COBRA, under Healthcare Reform Issues, we have added the exchange notice obligations. Many of our employers had us do them for them in October, and you need to do them going forward for all new hires, and that's another service that we offer. And finally, Beneflex in the COBRA area, we have added the language for our COBRA notices that does include the exchange notice verbiage that needs to be put in. Now, I do want to point out that I already mentioned about the HRA and the lost ability to pay individual health insurance premiums. But the most important thing that we're going to talk about under the HRA is that the change with 2013-54, no standalone HRAs can be started in 2014. You know, this is sad. It kills the HRA that we and many employers thought was the best option for compliance with San Francisco's HCSO. We're going to talk about the full impact of that and the other option that we think is a good package that you might be interested in. So the ordinance was launched in 2007 to subsidize medical care for uninsured residents of San Francisco. When this started in 2007, you had 3 options to be compliant with the ordinance. 1, insurance. 2, your standalone HRA from Beneflex. And 3, the city option. I mentioned earlier that on Friday, September 13, 2013, the IRS released IRS Notice 2013-54 and ERISA Technical Release 2013-3. We should have known for a notice to come out on the 13th on a Friday that it was not going to be good news. The guidance addresses compliance issues related to HRAs, FSAs, EAPs, and defined contribution health plan arrangements. That's the part that stops the ability for employers to use pre-tax dollars for their employees' health insurance premiums, individual health insurance premiums. Now, I do want to mention, if you have an off-plan year, you can run that plan out, but when it renews, you won't be able to do that anymore going forward. 2013-54, this is the guidance that forecloses the ability of employers to offer those standalone HRAs, MERPs, and standalone limited dollar HRAs. And as we've mentioned, the bad news, it forecloses privately sponsored San Francisco HCSOs beginning with plan year starting on or after January 1, 2014. What does that mean for my Beneflex administered HCSO HRA? The Health Security Ordinance still in effect. The IRS Notice 2013-54 only addressed the HRA plans that were being used to help employers be compliant with the HCSO. Your current 2013 HCSO HRA with Beneflex will keep you in compliance until 1/1/2014. You need to keep your current HRA to maintain compliance regarding the 24 months of funds availability as outlined by Healthcare San Francisco. You can do that, you can continue that, because healthcare reform allows for existing HRA accounts with a balance to roll forward and let the employees continue to use the funds until the plan or funds expire. Guidance on how Beneflex is planning to do the rundown. The 4th quarter contributions can still be made to the Beneflex HCSO HRA. They are due by January 15th of 2014, and they will be posted with a 12/31/2013 date. The ordinance requires that the funds be available for 24 months from the date they were posted to employee HRAs. Beneflex is administering a 24-month spend-down period. All employee balances will be available for those 24 months. During the HRA, the required rundown for this HRA, all plan documents, summary plan descriptions, summary of benefits and coverage, the quarterly statements that are required, and the proof of delivery will continue to happen. HCSO HRA services are not going to change for this rundown. Customer service, English and Spanish, is still going to be available for that rundown. All those questions that come up when the quarterly statements go out, there's going to be a lot of education that's needed for employees to understand how that's going to work. And we will also keep up the weekly claim reimbursements. So your employees should not feel any effects of this rundown happening. The due date of December 31st, 2015 will be the last day to turn in claims. Any unused funds will revert back to the employer. First quarter contributions in 2014 will need to be made into one of two options. You had 3 at the start of this program in 2007. Now 7 years later you have 2, an insurance plan or the city option to satisfy the ordinance. Now I just covered a lot of important dates for the rundown. We included a timeline here to present them in an as-needed fashion. So starting at the left, the fourth quarter rewards are going to be posted 12/31 of 2013. This makes you compliant with ACA and HCSO for 2013. The due date for those fourth quarter rewards to come to Beneflex is January 15th of 2014. And your rewards have always been due on that date, so it's business as usual. The fourth quarter statements for that time frame that we just finished will be sent proof of mailing on January 30th of 2014. And then we have the rundown statements that are going to be sent proof of mailing quarterly for the 24-month period starting with April 30th of 2014. So what that then takes us to is the happy last day for the employees to submit HCSO HRA rundown claims, which is December 31st, 2015. That's exactly 2 years, so it's in compliance with the ordinance. And normally there would be a quarterly report that would come out January 30th of 2016, but when the plan ends on the 31st, that is the end of your obligation to send out those statements. So the Patient Protection and Affordable Care Act, PACA, commonly called the Affordable Care Act, is a federal statute signed into law by President Obama on March 23rd of 2010. Many provisions of the ACA are going into effect on January 1 of 2014. The San Francisco Office of Labor Standard Enforcement published a set of FAQs to address some of the most common questions they were receiving from San Francisco employers and employees regarding the ACA's impact on the San Francisco Healthcare Security Ordinance. I wanted to review 3 of what we felt was the most important FAQs from the city, and we think this will confirm the important steps that Beneflex is taking to keep your plan in compliance going forward. So is the HCSO employer spending requirement scheduled to expire or go away when the ACA takes effect in 2014? No, the HCSO employer spending requirement is not scheduled to expire or go away when the federal health reform takes effect in 2014. The ACA does not preempt or regulate the HCSO, and covered employees will be required to continue meeting the HCSO employer spending requirements for their covered employees in 2014. An interesting sidebar here is where they say the ACA does not preempt or regulate the HCSO. You know what that also means is the city could have exempted your HCSO HRAs, but they chose not to. So those are going away. Next question. Since my business can elect not to make HRA contributions commencing in 2014, what happens to existing HRA balances at the end of 2013? The HCSO establishes that in order to constitute a valid health care expenditure, the full amount of an allocation to a revocable reimbursement program, such as an HRA, must remain available to an employee for 24 months from the date of the allocation. This provision will remain in effect. And that's the reason we're doing that allocation 12/31 2013. And lastly, if my business elects to no longer allocate funds to HRAs, what are my options to satisfy the HCSO employer spending requirement in 2014? And as I said, the options available to your business for satisfying the HCSO employer spending requirements in 2014 and beyond for your part-time and full-time employees that don't have an insurance from you or signed a waiver is an insurance given by the employer through the under the HCSO or the city option. So when we were faced with Notice 2013-54, actually I was out in San Francisco when that was released, and that was a sad day. Beneflex sent out a Benny Blast right away saying we were waiting for more guidance, that we were going to keep looking for another option in case the HCSO HRA went away for our groups, because we wanted to have something available for them. We looked hard for 2 months. We had 2 options that we had in our mind. One was we were hoping that the FSA rollover would come into play, and it did come into play, but at the same time, the IRS capped employer contributions at $500. So that disqualified the FSA carryover as something that could administer the requirements of HCSO. But during that same 2-month period, we were researching another option. We didn't want to leave our clients in the lurch, and we're really happy to say the due diligence paid off with us finding the Boone Group. This option goes hand in hand with our HRA roll down. This is an option we believe is going to save you funds for your spend down of the HCSO HRA. I'm excited to have Brad Billicky present what we think is the best option out there to help you keep compliant with San Francisco HCSO. Brad?
Good morning, everybody, and thanks for joining. And Mark, thanks for the warm introduction and turning over the next few minutes to me. I want to start out just telling you guys a little bit about the Boone Group real quick. We've been in business for 30 years. Our niche is working with government contractors. Now, you're probably thinking, we're not government contractors, why is he talking to us? Well, government contractors are subject to 2 laws, the Service Contract and Davis-Bacon Acts. Both of them have been around a very long time, and what they require is that hourly contributions in the form of benefits be made by the company for the employees. So essentially, the Service Contract Act is a federal law been around since the 1960s. It says that $3.81 an hour needs to be spent on health benefits for the employees. So sounds a little bit like San Francisco in the sense that San Francisco is $2.44 an hour or $1.63, depending upon whether you're a company over or under 100 total employees, and those are the rates as of 1/1/14. Now, what makes us unique at the Boone Group is that we create variable benefit plans, variable premium benefit plans. So instead of you dealing with a company that has a $400 or a $500 monthly rate, our rates are going to be $2.44 an hour or $1.63 times the number of hours that each employee works in a given month. And their premium can obviously change as the hours fluctuate. So similar to the HRA, where the contribution amount you needed to book changed based on the hours, the premium changes based on the hours that they work with us. Let's just see here there you go. The Boone Group is broker friendly. That is something that is very important to us. It is something that was obviously very important to Beneflex. We're a wholesaler. We work through brokers across the country. And just so you know, our client base on the government contract side ranges from Fortune 500 companies like Manpower and Northrop Grumman and companies of that size down to small companies mowing lawns on military bases. And everything we do through the brokers and pay a commission to the broker. That was a deal point for us. It was also a deal point for Beneflex, since those are both of our relationships. The Boone Group has a partnership with Transamerica. You're obviously all familiar with Transamerica. We market exclusively an hourly-based benefit plan designed for San Francisco for Transamerica. Now, we do more than just market for Transamerica. We do everything. We pay the claims. We handle the customer service. We handle the enrollment. We do the fulfillment, which is mailing out the health cards and mailing out any post-enrollment materials. They outsource everything to us, which is the same thing that all of our carrier partners do, whether it's Aetna or we've done business with Cigna over the years. When we do something with someone, they outsource all of the administration to our company. Okay, let's talk a little bit about how the benefit plan works, okay, because this is obviously important. I'm going to use the 244 as an example. This plan is designed for when we're covering both part-timers and full-timers, and we'll get into the differences a little bit later. We can just do part-timers, we can just do full-timers, or we can do a combination of both. The plan is broken into 3 classes based on hours. If your employees work 1 to 90 hours a month, they're in Class 1. If they work 91 to 130 hours, they're in Class 2. And if they work over 131 hours in a month, they're in Class 3. Now, you're probably thinking, well, wait a minute. We don't have to report unless people work 8 hours or more a week, which is 32 hours a month. We're not expecting you to send us money for anybody that works less than the minimums as required by HCSO. But on the federal side, federal contractors have to pay all the way down to 1 hour a month. So that's the way the plan is filed. But you will not be expected to report to us anybody that you're not required to report as of this point, okay? Now, 2 big differences between us and the HRA. The first one, obviously very painful. In the past, it was an unfunded, self-funded mandate where you spent the money if the plan was used. Based on the changes in the Affordable Care Act, we are a funded plan. So we're going to require premium every month like other benefit plans for that month's benefits. Now, what we do, and the other thing that's different, is instead of reporting quarterly, you need to report to us monthly. Because just like any other benefit plan your company may have, January's premium is paid in January, not in April. Okay? Now, what we do to make life simple for everybody, and this is what we do for our government contract clients, of which we cover about 100,000 employees across the country, is we will use December's hours report to justify and determine January's premium. January's hours report justifies and determines February's premium. February for March, March, April, so forth and so on. So that you don't have to know how many hours someone's going to work in advance. You're just basing this month's premium on whatever number of hours somebody worked last month. The plan can work in 2 ways, as primary or secondary coverage. Primary coverage means it's the only coverage someone has. Now, this plan uses the First Health PPO network, which is one of the largest PPO networks in the United States. Basically, I did a search in San Francisco. Within 20 miles of the Embarcadero, there were 6,400 primary care physicians and 25 hospitals. So, someone goes to the doctors. They look up the doctor in the PPO network. Doctor might normally charge $200 for a visit if someone doesn't have any insurance. Their negotiated discounts might be down to $80, $90, $100. Let's just call it $100 for round number. Well, in that case, we pay $50, the patient pays $50. If the doctor was their negotiated discount with the PPO network was $80, then the patient pays $30, we pay $50. We use the Caremark prescription drug network, which is great because it's one of the largest pharmacy networks in the United States, 62,000 pharmacies. It's all the household names. If you look at take Class 2, we're going to pay $30 for a brand name drug and $15 for a generic. Now, what does that mean? Well, most generics, as you know, usually cost $5 or $10, which means we're going to cover the cost of that generic, and we're actually going to send the difference in the form of a check to the employee to their home, because we're going to pay $15 for that generic regardless of cost, or $30 for name brand. Next slide, you look at hospital. Again, class 2. We pay $1,300 a day for 31 days worth of benefits. And additionally, if you look below where it says hospital confinement benefit, for the first day we pay an additional $2,500. So that's $3,800 for the first day in the hospital and $1,300 for every day thereafter. Let's talk about secondary coverage. Say someone has coverage through a spouse, through a parent, through the exchange, and let's say that plan has a $30 copay. Well, they're going to spend the $30, they're going to send us that paperwork, and we're going to mail them a check for $50 because we pay $50 for a doctor visit benefit. Let's move on to the hospital benefit. Say, for instance, spouse's plan has a $1,000 deductible. Person's in the hospital for one night. We're going to send them a check for $3,800. They can pocket the difference. If they're in the hospital an additional day, regardless of their out-of-pocket, we're going to send them a check for $1,300 for every day for the next 30 days of confinement. Plan also includes emergency room, dental benefits, as I mentioned, the First Health PPO network, a telemedicine benefit, which is great. People don't have to leave work. They're feeling sick. They can call a doctor. Doctor can prescribe something right over the phone. Helps to keep your employees at work instead of missing work. To summarize a little bit what we talked about, if you use the city option, okay, and this is where, as Mark mentioned earlier, where we save you money over the next 2 years. Because, you know, in the past, if your HRA was running at 15, 20%, 25%, you were pretty happy. But going forward, you're actually going to be spending the $244 or the $163, whether it's with me, with the city option, with another benefit plan. So you're going to want that HRA to run as close to 0% as possible. So if we look in the city option, someone has no PPO network. It's going to cost them $200 to go to the doctor, and that's if they don't order a blood test or an x-ray. They go to get a prescription, as we talked about. You know what? If you don't have a network, you may pay $50 for a generic. They're going to use their HRA. You're then going to have to fund $250 for that doctor visit and prescription. If they're in the hospital for a night, a hospital stay in the Bay Area can run you $4,000 if you have no PPO network. They're going to use their HRA if they're in the city option and they live outside the city, because it's going to be the easiest thing for them to do, because dealing with the city is never easy. $4,000 is going to be a hit on your HRA. Conversely with us, as we talked about, maybe they're out of pocket $30, $40, $50 for the doctor visit. The generic drug is $10. The use of the HRA is going to be far lower. They're in the hospital for the first night. There may be no out-of-pocket. I put down $3,100 here because that's what we pay if someone is in Class 1 for the first night in the hospital. So you can see the savings going forward to the HRA usage by using our plan. The plan was approved, and this is very important, on October 16, 2013 by the state of California as a fixed indemnity plan, as an accepted benefit under FAQ 7 of the Affordable Care Act. Now, just like some congressmen slipped in language that said that the standalone HRA is not allowed, some other congressmen slipped in language, probably because they were getting money from AFLAC, that said you can use a fixed indemnity plan as long as it meets certain requirements. And our plan with Transamerica meets all those requirements. Now, be very careful. I have seen some other plans floating around the city. They are not FAQ 7 compliant. Okay, you will get yourself in a lot of trouble. The fine is $100 a day per employee, and it's a post-tax fine, not a pre-tax fine. And so those plans have what's called per-visit benefits. Our plan, which is allowed, only has per-day benefits. So if you ever look at a plan similar to this and it has the word visit anywhere in the plan, it is not going to be compliant with FAQ 7. As you know, with the city, there is no minimum benefit requirement. There is a minimum spend requirement. If there was a minimum benefit requirement, obviously the city nor the HRA would have been allowed. We've interfaced with the city. We have an email back that says the plan meets the spending requirement for the city of San Francisco. Let's talk about who is eligible. Kind of mentioned it a little bit earlier. Oh, pardon my phone here. Who is eligible is all employees coming out of the HRA. As you know, the employer mandate was punted in 2014 for a year. So we can put both part-time and full-time employees on the plan who are coming out of the HRA for 2014. In 2015, if the employer mandate sticks and it doesn't get delayed again, then you will need to offer coverage that meets minimum essential value and is affordable to your full-time employees. Now, we use the same definition as Obamacare, which is people working more than 30 hours a week, which is 120 hours a month. We call full-time. People who work less than 30 hours a week, we call part-time. All right? So what will happen in 2015 and beyond is you will need to offer coverage to those full-time employees. If they don't take it and they opt out and don't sign the San Francisco waiver, they will end up back on our plan with the part-timers. Why? Because just offering coverage to people in San Francisco does not get you off the hook of the spend requirement. So we will still be there to help you with the spend requirement in 2015 and beyond. Now, the plan also does not meet the individual mandate, which is good because it does not eliminate someone's ability to get a subsidy at the exchange. So if you have an employee who's healthy, they will use our plan as their primary coverage. And if the individual mandate even sticks, which I don't know if you've seen the news lately, but the sign-ups have been dismal because of the website problems and the bad press, there's a pretty good chance that Congress is going to punt the individual mandate back. But if they don't, employees will have the choice of spending the $95 on the penalty and continuing to use our plan as their primary. If they go to the exchange and they decide to get a subsidized plan, then they'll use our plan as secondary coverage, and we will send them checks in the mail when they send us the paperwork. Very, very simple, very easy for them to do. So an employee who, let's say, is very healthy, they'll pay the penalty. Someone who's, God forbid, let's say a diabetic, will make the decision of going and getting a subsidized plan. Requesting a quote, very, very simple. We have two criteria to be able to work with you. One is you must have 50 total employees in the company. Now, I don't mean total in San Francisco. I don't mean in your HRA. Total in the company, that includes exempt employees. We need 15 minimum to write the plan. So we need 15 eligible under HCSO in order to write the plan, and 50 total. Very simple information we need about your company. Name, address, phone number, contact person, and title. We need to know the total number of employees in the company. It's just a box we have to fill in. And we need a very simple census and hours report, which basically is the date of birth and zip code of where your employees live and the number of hours they worked in the last quarter. Now, the good news is that Beneflex can send us this information. They have the information, and with your blessing, they can send us the information on your company as well as the census and hours report. If they don't have your NICS code, they can just send us the industry type you're in, and we can look up the NICS code ourselves. So again, very easy to get a quote. We're turning around quotes within 7 days and sometimes in 3 or 4 days. Right now we're getting a little backed up. We're receiving about 4 to 5 quote requests a day from companies that are affected by HCSO. Enrollment, very simple. We do not want anybody chasing paper from their employees. All the enrollment is going to be spreadsheet done. We're going to get you a spreadsheet. which is going to have all the demographic information we need if you decide to move forward after seeing the actual proposal, which is going to include name, address, social security number, date of hire, date of birth. You send it in, we auto-enroll everybody. Once we have that information, we will send all post-enrollment materials directly to the employees' homes, the cards, any post-enrollment kits, anything they need. What we'll do to make life easy is we will drop ship pre-enrollment materials to your place of business, which will have a benefit summary and a welcome letter basically saying, please call the following 800 number 7 days a week in order to ask questions about your plan and have it explained to you. We have bilingual operators, Spanish and English, that can handle the questions. We talked earlier about monthly reports as opposed to quarterly reports. Very simple information we need. Name, social security number, hours paid in the previous month. You're done. We do everything. We take everything off your hands. We make this very easy on our clients. Your self-reporting, we talked about that earlier. Just like the HRA, just like the city. We don't know how many hours your employees work, therefore we can't bill you because we don't have a set premium rate. We have a set rate, which is $2.44 or $1.63, but the premium is tied to the number of hours. Now what we send back to you every month is what's called an on-benefit report. And it's basically something for audit trail purposes that we do for all of our federal clients. And this will help you with your San Francisco reporting because it's going to have all the totals of everything on it, which will make life really easy for you when you need to report to the city of San Francisco anything, any hours or whatnot. Again, why should people use us versus the city? Well, to summarize, it is a better benefit plan for the same price. So what you're giving your employees, and it's going to be painful, I know, spending the money, but the bottom line is you're spending it, you might as well buy a better benefit, better value for your employee. But more important, it is going to save your company money during the HRA rundown. You've got that exposure for 2 years. If people have no network, they're going to go to the doctors, pay full retail, go to the hospital, pay full retail, and they're going to look to their HRA to reimburse them based on what's available for them for the next 2 years. If they use the First Health PPO network, the good news is the network discount and the benefits we pay is going to reduce any exposure you have. In some cases, it may eliminate the exposure altogether. Questions I always get asked, timing to get a quote. As I said, we're turning around quotes within a week, sometimes 2 to 3 days. You can cancel anytime. None of the agreements with us lock you into anything. The bottom line is we deal with federal contractors who lose contracts all the time. I'm sure you're all familiar. You watch the news with the sequester that happened with the federal government. We had clients that only had one contract. Their contract was taken away from them under sequester. They had to lay the employees off. They basically sent us a note saying, sorry, we need to cancel. We let them out immediately. We are not here to lock anybody up. No one's an indentured servant to us. So anytime you need to cancel, if there's ever a change in the law, maybe the city decides HCSO is going away, you can cancel with us. We handle all the customer service and benefit questions. So we make it really easy. Your employees are not needed to answer questions. Employees will have the phone number. They have it on their health card when they get it. They have it in the pre-enrollment kits. They can call us, ask questions. We are available to answer the questions and make your lives easier. I think at this point I'm going to turn it back over to Mark. I first want to thank everyone for their time and energy. I know this is a very confusing and painful time for everybody. There's a lot of crazy rumors running around the city of things that people think will work. I'd be very, very, very careful. I know of a janitorial company that got fined $1.3 million last year because they tried to do this reimbursement thing on their own, which was out of compliance. There's just a lot of stuff floating around which is just not true, and you need to be very careful. So anyways, thank you very, very much. When Mark's done with this slide, my information will be up on the next slide, happy to respond to any questions on the phone or via email with anybody, and I look forward to working with everybody, and thank you again for your time.
Thank you, Brad. And as you mentioned, at this time we are going to take questions from the audience. Please submit your questions via the text message box, and any questions we don't get to on this call will be addressed afterwards. We're going to post a Q&A document and a recording of this webinar on our website, and that website is up there. I do see a lot of questions coming in, so let me find the appropriate ones and try not to repeat. The first question says, regarding the Beneflex HCSO HRA rundown, it's business as usual until the 24 months expires, but no new HRA accounts start in January of 2014, correct? And that is correct. It is going to be business as usual. We'll be answering questions, helping your employees to make sure that they're taken care of appropriately and that you are meeting the guidelines set forward by the city. Brad, I believe this next one is for you. Oh, it's a softball. How does such a small hourly rate premium meet the minimum spending requirements of HCSO?
That's an excellent question. Well, the minimum spending requirement of HCSO is $2.44 an hour and $1.63 an hour, just like it has been on the webinar. On the HRA, excuse me, that we talked about on the webinar. So, really easy. Right now, what you've been doing is you're sending an hours report, essentially, a contribution report to Beneflex, saying Tom Smith worked, let's just say, 32 hours in a month, and you're sending that to them. So you've met the requirement, 32 hours times 244, $1.63. Or Mary Jane worked 172 hours at $1.63 or 244. You're doing the exact same thing with us, except for you're reporting monthly instead of quarterly, and your only obligation under HCSO is to spend 244 times the number of hours that your employees work in excess of 8 hours a week and up to a maximum of 172. So I hope I answered your question. If not, please pose another one and I will try it a different way.
Brad, the next one is also for you. Is there an option to send the eligibility quarterly to Boone, or does it have to be monthly?
Okay, here's the problem with the quarterly issue. And again, we're a benefit plan as opposed to the unfunded, self-funded HRA situation. And here's what I'm sure you're aware of. I'm sure you guys have benefits for other employees in your company. Your January premium is due in January. Your January premium is not due in April. Now, the one way we could work it out, which is extremely counterintuitive, and I would be shocked if anybody wanted to do it, is if you wanted to take October, November, December's hours reports, and you wanted to send us 3 months of premium in January, we could have that cover January, February, March. And then if in April you wanted to send us January, February, March for April, May, June, we could probably work out a way to do it. But then you'd actually be sending us 90 days worth of actual money up front, as opposed to sending us 30 days of actual money up front. So instead of sending us 1 month's hours in early January, you'd have to send us 3 months' hours in early January, because there's no way for us to collect the premium in April to cover actual benefits because we're actually paying claims for January coverage, and you have to have coverage in January in order to be compliant with the HCSO.
Very good. The next question, I believe, is for me. How is the 24-month expiration computed for the HRA, Since contributions are recorded quarterly, our contributions dropped for each quarter that expired until the balance goes to zero. And that's exactly how that'll work, Rhonda. It's going to slowly run down, and as the 24 months goes by on the rewards, they will drop off. Brad, the next question for you. Are the rules the same for employers with less than 50 employees? I guess he's talking about the insurance.
Okay. If you're a company that has less than 50 total employees in your company, so let's assume you own I don't know, you own a bakery and you've got 35 employees and that's your only business. Okay, you don't have other businesses that we can link together under common ownership. Unfortunately, we are not an option for you. You would need to send the money to the city or find another alternative because we cannot write what's called small group. Now, if you happen to own 3 bakeries, and even if you had it figured out that you have them in separate entities in order to stay at $1.63 instead of $2.44, we could work around that as long as we could write the benefits to the parent, essentially, or any one of the companies to cover the other companies. We could figure out a way to do that. But no, if you have less than 50 total employees and that's what you've got, unfortunately, we are not a viable option for you.
All right. What is the benefit for preventative services?
Well, the benefits that are listed on there, it is more of it is a wellness plan. Okay, excuse me, it's not a wellness plan other than Healthy Achievers, which is listed on there. Healthy Achievers was one of the benefits that was at the very bottom, which is a program where they will come in, give flu shots to your employees, do biometric screenings, make sure everybody is as healthy as they think they are, because the key to health is obviously finding out when there's a problem earlier than later. And obviously flu shots are great because they keep people working and not missing 3 weeks of work when they're sick. But the benefit plan is designed for when employees are ill. There are no preventative services required in this type of plan because, again, it's what's called an accepted benefit under FAQ 7. It does not need to meet the requirements of the Affordable Care Act, which call for all those preventative services that you'll need to provide in 2015.
Okay, there's 2 questions on here that are similar. They might lead into each other. We have employees in San Francisco and outside of San Francisco. Can we use this plan for both groups of employees?
Okay. It's a tricky question. The answer is essentially yes and no, and I'll explain what I mean by yes and no. We only write hourly-based benefit plans where there is a regulation that enforces how many hours you're going to send us. Because we have never audited any of our clients in the 30 years we've been in business. We know that, or at least hope and assume, that if you tell me that Tom Smith worked 147 hours in January, that he really didn't work 160. Why? Because you're not going to want to get audited by the city of San Francisco, and when they go to check your payroll reports against our on-benefit reports, you're not going to want a discrepancy. So we always know that our employer groups send us what they're supposed to send. What we can do is we can convert this plan into what's called a flat rate premium. So we could convert it, so instead of it being $2.44 an hour, it would be X per month that you would then pay. Because we don't then care how many hours an employee works, whether they work 1 hour or 160 hours or 172, because for the non-San Francisco employees, there is no regulation linking hours to premium.
So that leads to a similar question, and maybe you answered it, Brad. We are an employer with multiple locations in California and Colorado. We have been informed by our broker that we can't carve out insurance benefits for San Francisco employees only. Can we offer the Boone Group benefits only to San Francisco employees and still be compliant with ACA?
Okay. He's not incorrect, but he is incorrect as it applies to this particular situation. All right. He's discussing the discrimination laws that will be going forward versus the highly compensated employees in your company. Now, first of all, you can provide different benefits for different classes of employees. So people do it all the time. I mean, we have huge multinational companies as clients that have a whole variety of benefit plans depending upon their classes. Where he is incorrect when it comes to San Francisco is that this is not technically, under the Affordable Care Act, a benefit plan. It's an accepted benefit. That's accepted with an E as opposed to accepted with an A. All right? So you can use this plan to meet the requirements of HCSO, and it has no effect on what you do for your other employees in other locations, whether you choose to offer them coverage now or you choose to wait until 2015 when the employer mandate kicks in. In 2015, as I said earlier, you're going to offer your full-time HCSO employees the corporate plan because you have to offer them coverage in order to not get fined under the employer mandate. Those employees that take it, great, whether it's the same plan you're offering your entire company or not. Those employees that don't take it, that opt out because they don't want to contribute, because I am guessing that most likely, like most companies, you're going to have a contribution strategy in 2015, which can be as low as 60% covered by the employer group, and of course you can't go below the contribution exceeding 9.5% of somebody's salary. But you're going to find that a lot of these workers in San Francisco are going to opt out. But they're not going to sign the San Francisco waiver because there's very few people that sign it because there's just no benefit to them in signing it. Those employees that opt out will end up back on our plan with the part-timers. Again, our plan does not have any effect on the discrimination laws because A, it's an accepted benefit, but B, part-timers are not subject to the Affordable Care Act. So you can do anything you want with your part-timers, and you're not discriminating. You can put them on this plan, and there will never be a discrimination issue regarding part-timers in other locations. And again, the full-timers that have been offered coverage, either now if you choose to offer it to them in 2014, you don't have to wait till 2015, or in 2015 and beyond, if they don't take it, you've complied with the Affordable Care Act, and they will end up back on our plan with the part-timers.
So we have a lot more important questions. Here's one from Joyce. What happens if an employee doesn't have hours for a month? Do they lose their coverage for that month?
Very good question. The answer is yes, just like the HRA. If someone doesn't work in hours, you're not contributing to the HRA for them that month. Well, the good news is we offer something called continuation of coverage, which is just like COBRA. And by the way, we handle the billing, collection, and notifications. You don't do anything. When someone falls off a contribution report, our COBRA department will send out a continuation of coverage notice that says if you'd like to continue the plan, same rules, 18 months, just like the COBRA rules, you can pay the premium yourself. If they choose to continue the coverage, they send us a check. If they choose not to, they don't. But remember, they still have their HRA during that month for the next 2 years in case they need it. Now, when they start working again, boom, they pop right back on the plan again the following month. So, because remember, February hours pay for March's benefits. So if someone doesn't work in February, they won't have benefits in March, but if they work in March, they pop right back on the plan in April.
What is the administrative cost to employers for making the switch to the Boone Group option, setup fees, and ongoing monthly?
Excellent question, and I am delinquent for not commenting on that during the presentation. The answer is zero. There are no setup fees, and there are no fees at all to do business with us. We are paid by our carrier partner, Transamerica, to do everything, including pay the broker a commission. They pay us to do everything from sales and marketing that I'm doing now, to do the customer service, to pay the claims, to provide the on-benefit reports, to do the fulfillment. We actually print and mail out the cards ourselves. We own a print shop in the basement of our building, in our office building, where we print the cards, print the packages, and we do everything for Transamerica, and they pay us. Your total cost with us is $244 or $1.63 times the number of hours your employees work in a given month, never a penny more.
Is there a deductible for the Boone plan?
No, there is no deductible. This is what's called first dollar coverage. So you're in the hospital, you do not have to satisfy a deductible. It will pay what it lists first moment right in.
Can you explain again how the PPO takes the place of the pay down balance when there is an employee claim?
Okay, good question. Someone goes to the doctors. They're in the city option. They have no network. The San Francisco Bay Area is one of the most expensive places to go to a doctor or a hospital in the United States. That's why the premiums for insurance are so high in the Bay Area. You go to the doctors, it could cost you $250 without a network. Someone is going to send that to the HRA for reimbursement. When you go to get a prescription and you don't have any network or any pharmacy discounts, generics can cost $30, $40, $50, $60. Name brand drugs can cost way over $100, $200 for a drug. They're going to send that money, those bills, to the HRA for reimbursement. A hospital stay, like I said, could be $4,000. That's if you don't even have a surgical procedure or give birth while you're in the hospital. You're just in the hospital because you don't, for whatever reason, it could run you $4,000. They're going to send that to the HRA. With our plan, because of the PPO network, and it's just like any PPO network, if you're on Blue Cross or United or Aetna or Cigna or whatnot, every doctor has their own, and hospital has their own individual negotiated deal with the PPO network. So when you go to a doctor in the PPO network, if their negotiated deal is $90 that they're going to charge the First Health PPO network members, and we pay $50, then the patient is only out of pocket $40. Now remember, the doctor is going to bill us in almost all cases, if they're using the PPO network, the $50. So now your employee is only charging the HRA $40 instead of $250 for that doctor visit. If there's a blood test or an X-ray, we also pay towards the blood test and the X-ray, and those are negotiated by the First Health PPO network. Go to the pharmacy. You're going to get the network discounts that everyone gets, the same discounts you or I or anybody gets on our regular plan, and your generic copay might be $5, $6, $7, $10. So that's how we're saving money during the rundown of the HRA, because you guys are still on the hook to that HRA for the next 2 years. So you're going to want, because now that you're paying the premiums, you're going to want those claims to the HRA to be as small as possible.
So how can we get the slides for the benefit overview? Brad, I would think that we'll just take and email every single participant the overview of the benefits so they have them in front of them and can print them out. Are you okay with that?
I'm fine with that. And one thing you can do is, I know this is mainly companies, there may be some brokers on the call too. You know, you can reach me, You can, again, we're broker friendly, so our goal here is to always do business and pay your broker. I want to make sure everybody's clear on that. But we can send out, I can send out one-page samples because I want to make sure everybody's clear on something. This is a 244 all-time plan. There is also a 244 part-time plan. What is the difference? If you're only giving us part-timers instead of full-timers and part-timers, the benefits are different. Actuarially, the plan does not run as well, so the benefits are lower when we only get part-timers. There's also two $1.63 versions. There's one version, $1.63 all-time, which means we're getting part-timers and full-timers. And there's a $1.63 when we're only getting part-timers. So I just want to make sure I'm really clear on this because I don't want anybody to think in any way we misled anybody, because that's just not who we are.
Well, and that's right, Brad. The employers have part-time and full-time people that are in the HCSO, and so that makes sense that you would have two plans. And that question, you made a comment about the broker. The next question, should I contact my broker or the Boone Group to discuss this? Well,
I mean, if you have questions you want to ask me, I'm thrilled to talk to you and answer any of your questions. You'll see on the last slide that my contact information. Would you go to the next slide, Mark?
The contact information.
Yeah, go to the contact. Okay, the answer is there's my contact information. There's my 800 number. There's my email address. You are welcome to have your broker call me. I'd be thrilled to talk to your broker because think about it from my perspective. Your broker may have other clients. If I get introduced to your broker, I leverage your broker. Instead of writing just you, maybe I write you plus 3. That's the business I'm in, just like you're in business to sell more of what you sell. But if somebody wants to ask me a question, I am here to answer anybody's question anytime.
Rhoda says, basically this plan is unlike our current standalone HRA, where unused funds revert back to the employer. This is designed to decrease exposure on the HRA for the 24 months. Is that correct? And that is correct.
Yeah, that is correct. I mean, that's the only way I can say is, unfortunately, the unfunded mandate has disappeared as of 1/1/14. So now the options are you got to spend the money. Whether you spend it on me, spend it on the city, or spend it on another insurance plan, the difference is, as we've discussed, is that our plan, in addition to meeting the requirements of the HCSO, will save you money over the next 2 years on the HRA rundown.
Ann asked, how do we meet the 244 spending requirement for full-time employees on our health insurance? In some cases, even if we pay 100% of the premium, we're not spending enough for San Francisco. Is there a way to buy up coverage for the difference, either with the Boone Group or the City Group plan? What do you suggest?
The City plan. Unfortunately, as much as it pains me, if, for instance, I'm going to give you an example. Say you have a full-time employee working 172 hours. Well, 172 times 244, I believe, is 419.68. Okay? Let's assume, for the sake of discussion, that you have a plan that costs $400 with Kaiser. Send the $19.68 to the city. As much as I hate to ever say send money to the city, that would be my best advice. Where we really help people is if your hours are fluctuating. Because the problem is if the hours drop below the break-even point, you're going to have to make up the shortfall. Because if you don't make up the shortfall, you can't ask the employee to make up the shortfall. So then they fall off benefits. Well, if they fall off benefits, what do you do with the 244? So really, though we're doing some companies that have all 40-hour-a-week employees and there's no fluctuating in hours, we're quoting a bunch of those groups. The majority of the groups we're quoting have fluctuation in hours.
And you're quoting that working through their brokers?
Yeah, of course.
Okay. And I'm going to pick this last question, and then we're going to have to post the rest of them. I will work with Brad to get answers up so they're on the website. The last question is, do you provide services to conduct informational sessions for employees, and is there a charge to do this?
Okay. Well, again, in certain situations, I'm not opposed to going out and doing an enrollment meeting if you can get enough bodies in a room to justify it, where I could go over the benefits with somebody. Primarily what we're doing is we're doing what we discussed, which is spreadsheet enrollments, and we're providing toll-free numbers for them to call at their convenience to ask how the plan works. That's what most of the companies we've discussed would rather have. They don't want to take time during their workday to have someone come up and do a presentation. It tends to be disruptive. But, again, that can be discussed on a case-by-case basis.
And sometimes do the brokers do that meeting because they work so closely with you?
Oh, yeah. I mean, the brokers can. I mean, I don't have to do them. I'm based in Southern California, though I'm up in the Bay Area a lot. The answer is sure. I mean, you know, a broker could sit through a meeting and then do any follow-up meetings. But our operators, just so you know, the people we have manning the phones are not in a foreign country. They are in Austin, Texas, in our headquarters, where we have a staff of people that work for our company. We don't outsource this. And so, you know, they care. They're going to treat your people with respect. They're going to give them the time and energy that they deserve, because they're not rushing off to the next call because they get paid on a per-call basis or some nonsense. These are employees. They're salaried employees. They get paid whether they're answering the phones or they're not.
You know, Brad, one more good one slipped in. If there are at least 50 employees and 15 currently in the Beneflex HRA program, will it matter if there aren't 15 at the time of enrollment? Okay.
The answer to the question is, if you're asking me if it slipped to 13 or 14, would we cancel the group? I'm going to say 99.9% no. Okay? If it slipped to 6 or 8 and fell into single digits, I'm going to say 50-50. Really, we look for 15 because we have certain costs, as you can imagine, of just like you do, of running your program, and we really don't cover our costs at much less than 15. And so there's no hard, fast rule. You know, we're not going to cancel you at 13 or 14. I'm almost sure, okay? It's the best answer I can give.
All right.
I mean, we're writing companies, just so everybody knows, we're writing companies and quoting companies that have hundreds and hundreds, and I believe we have some we're in discussions with that have well over 1,000. So there's no limits on the upside. And again, we have, as I said before, we have national clients like Northrop Grumman and Manpower on the federal side that have thousands and thousands and thousands of employees with us. So anyways, thank you everybody for your time. I'm here as a resource to you as your broker, as is Mark, who has become an expert on the Boone Group as of late. And everybody have a good rest of the week.
And let me echo that sentiment. We greatly appreciate your time. We appreciate the fact that you allow us to do your work for you and to work with you and provide these types of services. Reach out to myself or Brad as we move forward. Be happy to talk to your brokers if you want to have them contact us. But whatever we can do to help keep you compliant for the 24-month run-out and for the January 14, 2014 going forward, we're happy to do that. Thanks, everyone. Have a great day.